A new study has found the wait times when it comes to our healthcare industry reached 22.6 weeks last year in 2020. That is the longest ever recorded and 143% higher than the 9.3 weeks Canadians waited back in 1993 when wait times were originally tracked. Joining me now to talk about this is Bacchus, the Associate Director of Health Policy Studies with the Fraser Institute in Vancouver, and one of the co-authors of the study, which you can read by visiting the Fraser Institute's website. Bacchus, welcome back to Bridge City News.
Thank you so much for having me on.
You bet. Now, first of all, I think people might argue that the longer wait times in 2020 were simply because of COVID and the crisis going on right now. Is that the case, or is there evidence to suggest otherwise?
You know, I think it's important to say up front that our healthcare workers are just doing a fantastic job, and they deserve all of our support and all of our gratefulness and appreciation for the terrific hardships that they've faced. 2020 was, of course, a very difficult year for a number of different reasons. And one of them shows in our survey, and that's that Canadians across the country were waiting longer than we've ever recorded in our survey. As you mentioned, the average wait time that we saw between getting a referral to getting treatment was 22.6 weeks. Now, absolutely, COVID will have likely had an impact on those wait times. But one of the things that we can do is we can actually just look at what wait times were the year before. So when we look at wait times in 2019, we actually find that the wait time even then was at about 21 weeks. So I think what the survey is telling us is that COVID has likely exacerbated the wait time situation, but unfortunately, wait times have been a historical issue in Canada and seem to persist and only get worse because of the current pandemic.
Now, Bacchus, can you explain exactly how you measure the wait times?
You know, we've been doing this study for almost 30 years now. And the way that we do it is we try and contact every single doctor who is part of the Canadian Medical Association. This year, we're looking at about more than 10,000 doctors who we tried to contact. We have responses from about 1,200 doctors, which is lower than usual, lower than other years. It's about 11%, but because we're surveying the population of physicians, that's still a very large number. In Alberta, it's almost 200 doctors who responded to our survey. So these are, real experiences from real doctors. We're looking at 12 different specialties. These were specialties that were decided in conjunction on the advice of the British Columbia Medical Association in the early 1990s. It's, like I said, a very old survey. And, fortunately in Alberta, we do seem to have responses from about 200 physicians in those 12 specialties.
So how bad are things really? What are doctors telling us? To what degree are patients having to wait for treatment after seeing a specialist?
Well, as you mentioned, we're actually looking at two different portions of the wait time. The first wait that patients face is between getting a referral to seeing the specialist, and that's at about 10 weeks. And then there's a further wait from seeing a specialist to actually receiving treatment, which is at about 12 weeks. Most governments have usually tended to focus on that second wait time, and although there have been some very good improvements about tracking that first wait as well. But when we're looking exclusively at that second wait, when essentially a physician and a patient have decided that treatment is required, we're seeing that physicians are reporting that their patients are waiting about 4 weeks longer than what they consider to be clinically reasonable. And that number is even longer when we look at Alberta, where it jumps up to almost 6 weeks longer than what is clinically reasonable. Never mind what is actually comfortable and desired by the patient themselves.
So Bacchus, big picture right now, are wait times actually improving in Canada, or are we getting progressively worse?
Unfortunately, it's bad news. As I mentioned, we've been tracking this for 30 years. When we started the survey, the wait time was only 9.3 weeks. And even at that time, that caused a huge stir. But unfortunately, over time, we're seeing wait times go up and up every single year. And this year, it's 22.6 weeks. As you mentioned, COVID has likely impacted that wait time, but this is a long historic issue that we've struggled to grapple with. And unfortunately, we don't look like we're winning that fight right now.
But aren't we spending more tax dollars than ever before in healthcare? And if that's the case, why on earth are wait times getting so much longer?
We saw massive increases in healthcare spending, particularly between 2000 and 2010. We've seen, some dips in that spending, never decreases, but the slowing of the rate of growth in the middle of the 2010s to 2015-16. And again, we're starting to see a little bit of an uptick back in the spending. Unfortunately, the answer is, I don't know. We're not seeing that money translate into shorter wait times, despite there being several programs that actually target those funds into tackling wait times. What we're seeing consistently is that regardless of what's being spent, wait times have increased over time. The one thing that we haven't really tried, or that very few provinces have tried, is actually looking at differences in policy. Now, some of that is restricted with regards to what provinces can do within the confines of the Canada Health Act, but there are a number of things that provinces could potentially try. But unfortunately, we live in a bit of a risk-averse environment when it comes to policy, where essentially a lot of politicians try to not touch healthcare lest they get a lot of backlash, which is very unfortunate because essentially it means we're going to be stuck with the problems that we've seen historically.
I'm curious to know which province had the longest wait times and which one had the shortest.
Unfortunately, we do see the longest wait times in most of the Atlantic provinces, particularly in Prince Edward Island and Nova Scotia, where wait times are crossing 40 weeks. Now, this has been a historical departure. The Atlantic provinces have traditionally struggled a little bit more than the Canadian average, but those differences were much, much smaller in 1993 and 1994 when we started measuring it, and that gap has only widened over time. Unfortunately, in our study, we can't actually pinpoint and identify why those differences occur, but this is precisely why we do the studies, to say, hey, there are differences amongst these provinces. Have a look. Let's try and understand what's actually going on in these different provinces.
So what can we do, or maybe the government do, to try and improve those wait times?
I think in this global scenario, one of the things that COVID has done is brought the world together in a very unique way. It's made us much more aware of different parts of the world, of the same and similar struggles that we face, and the fact that there are several other healthcare systems that we can learn from. I think one of the things that is important for Canadians to know is that we aren't alone or unique in our desire to have a universal healthcare system. There are at least 28 other countries with universal healthcare around the world. These are countries like Switzerland, Germany, the Netherlands, Sweden, France, Australia. They all share the same goal, but they have far more resources than we do. They have much shorter wait times. Canada, in fact, is ranked somewhere close to the bottom when it comes to physicians, close to the bottom when it comes to beds, and certainly lost when it comes to our healthcare wait times. We do well on certain other things, but these are clearly areas where we're falling behind. I think it would be a really good first step to say, what are the things that these other countries do differently? What can we learn from them? And what can we actually use in a Canadian context? Unfortunately, if we don't do that, if we stick with the policies that we have, we're also going to stick with the problems and the failures that we have in the Canadian system. All I think everybody wants to do is to try and improve the healthcare system to the best that they can.
Are you finding that more and more Canadians are deciding to, skip the queue and maybe go down to the United States for their surgeries, or even further south to Mexico?
No, this is something that this particular study is not being looked at. We have a bit of a tangential way to try and understand how many Canadians are actually traveling outside of Canada, not particularly in the US or other countries. But we're relying on doctors knowing that's what's happened. And it's difficult that patients would generally tell their doctors. There are, however, some other wonderful studies actually done by a Canadian institute, Second Street Consulting, that I think identified more than 200,000 Canadians who traveled abroad. Our last estimate was that it was about 50,000. But again, this is for the procedures that we're looking at, and I think are likely conservative estimates.
So Bacchus, circling back to Canada here and Western Canada, how well did Alberta rank when it came to wait times?
Unfortunately, Alberta is facing some very, very serious challenges. Alberta is ranking 7th out of the 10 provinces. The wait time is longer than the national average, and it's certainly longer than some of the top performing provinces like Ontario and Quebec, and indeed even Saskatchewan and BC. The total wait time that we measured in Alberta last year was 29 weeks. And as we talked about earlier, the national average in Canada is 22.6 weeks. So even though we are seeing historically high records in Canada, that same story is true in Alberta, but to an even greater extent, where the 29-week wait is, again, the longest that we've ever recorded in Alberta's history.
Now, among the various specialties out there, national wait times were longest between a referral by a GP and ophthalmology surgery, 34.1 weeks. What's the reason for such long wait times for eye surgery?
We're actually seeing very similar long wait times for orthopedic surgery and elective plastic surgery as well. It be a little bit of a mixed bag together with these three procedures. In Canada, we generally have a triage system like most other countries where, if you're a patient who is looking for medical or radiation oncology, you are going to get obviously prioritized. The problem is in Canada, everybody else really seems to be brushed off and expected to wait almost years for treatment. Again, in Alberta, actually, if we look at otolaryngology and orthopedic surgery, the wait time is at or in excess of 1 year. Essentially, we're in a situation where, if you have a serious condition, yes, our healthcare system is probably pretty good and will try and save you. Unfortunately, if it's something that won't kill you immediately, if it's something that is just going to be painful for people for a long time, you're expected to live with it and just put up with the long wait time. And I think that's really what we need to remember. These are real patients that we need to take care of.
Now, the shortest wait times are for medical oncology, which is a pretty good thing for cancer patients. I think it's just over 4 weeks, correct?
Absolutely. We are seeing much shorter wait times for medical and radiation oncology, which is about 4 or 5 weeks in those procedures. But again, this is really getting back to, yes, we should celebrate those wins, but at the same time, that doesn't mean that we should forget all those other patients, those patients who are waiting 34 weeks on average for eye surgery, those patients who in Alberta are waiting over a year for orthopedic surgery. We need to find a little bit of a balance to try and figure out how we can actually attend to all of these patients, or at the very least, try and give them some sort of option or alternative for recourse when the public system cannot help them because of the burden and pressure it's under.
As you know, Bacchus, the COVID-19 pandemic has been devastating for people's mental health all across North America and around the world. Do we know if wait times for psychiatrists and psychologists have increased due to the COVID-19 pandemic?
Well, our survey can give us a little bit of an understanding. We are asking psychiatrists how long their patients are waiting for treatment, and our estimate is actually very similar to the estimate for the 12 procedures. It's somewhere about between 22 and 23 weeks. But I do need to provide caution because we do have a much lower response rate for psychiatry this year. But again, this is something where if we look at it historically, in general, we are finding excessively long waits. A very similar story where patients are waiting longer than what's considered to be clinically reasonable for psychiatry patients as well.
What about wait times when it comes to various diagnostic procedures such as MRIs or CAT scans? What are we looking at there?
This is a really critical issue. We talked about triaging, and one of the key tools that we need for triaging is access to diagnostic technology in a timely manner. Unfortunately, again, we are seeing incredibly long wait times for these diagnostic procedures. For MRIs, it's about 11 weeks in Canada. For CT scans, it's about 5 weeks. And again, in Alberta, this is an area where Alberta is really, really struggling. For MRIs, the average wait time in Alberta is in excess of 25, I believe it's 26 weeks. And for CT scans, it's about 14 weeks. So, huge issues there. We can't really expect to have a functioning triage system if patients can't get diagnosed on time. So this is really something we need to work on and focus on, I think, quite urgently.
So what can we really do to improve our healthcare performance? What can we learn from other countries who are doing so much better than Canada?
That's a difficult question. What I can say is that there is a set of universal healthcare countries that tend to have more resources, shorter wait times, and are spending about the same as we do. These are countries like Australia, France, Germany, Sweden, Netherlands, Switzerland. They all tend to do three things differently. The first is they have a very different approach to the private sector. Unlike in Canada, where we see them as sort of the antithesis of our public healthcare system, over there they embrace them as either a partner to help deliver on the universal promise, or as an alternative to say, okay, when the public system is burdened, patients can access these services privately. The second is they expect patients to share in the cost of treatment. Now, this is something that can be very controversial in Canada, but most of the universal healthcare systems do expect small co-payments related to your income and with caps so that it's never a financial burden. The third thing is that they fund their hospitals based on activity. This incentivizes hospitals and pays them every time a patient comes in. In Canada, because of our government-only approach, we have what's called global budgets. And essentially, while that's good at controlling costs, what it does is it sort of makes hospitals see patients as a cost in an economic term, because every time a patient comes in, they're eating into that budget. Now, it's not to say any one of these things will magically fix Canada's healthcare system or that they may even be palatable in Canada's context, but it's important to know that these are things that other countries that do have shorter wait times while having universal healthcare do differently. So let's try and figure out what actually works in a Canadian context to just help all these patients who are waiting inordinately long for their medical treatment.
Bacchus Barua, the Associate Director, Health Policy Studies with the Fraser Institute, and one of the co-authors of the study, Waiting Your Turn, Wait Times for Healthcare in Canada. Thanks for joining me today from Vancouver.
Thank you so much for having me on the show.